For Action News, I'm Anna Smovska. The incredibly successful battle against HIV and AIDS has undoubtedly saved many lives and continues to do so, all thanks to effective combination drugs. But if there ever were an example of the law of unintended consequences, ACTIA's Dr. Josh Bloom says this is it. When effective combination drugs started hitting the market back in the 90s, the number of AIDS deaths in the U.S. plummeted.
They essentially knocked down the replication of HIV to the point where you can't even measure it anymore. So that does two things. First of all, it stops the attack of HIV on your immune system. The immune system recovers and you get healthy. It also prevents the transmission because there's so little HIV in your body that the chances of transmitting it are much lower. It's really a preventative and a therapeutic drug or drugs.
And the drugs only got better. In 2004, Gilead's Truvada was approved. Soon, it was clear the drug could be used both for treatment and prevention.
When it became obvious that these antiretroviral drugs were so effective, people no longer were concerned as much about being HIV positive because in a number of studies under different conditions, HIV-infected people are predicted to live about essentially a normal lifespan. So this made unprotected sex very popular again. So condom use was really declining because you could take this drug and 95% of the time you wouldn't transmit it to someone who was uninfected.
The result, while deaths from AIDS decreased, the number of HIV infections didn't go down, which is partly why the CDC has released a timely recommendation urging those at risk for HIV and AIDS to use both condoms and Truvada to prevent transmission.
We're talking about a different generation of gay men now and 30 years ago when you had to be careful or you were dead. Now you don't have to be careful when you're not dead. So this is the behavior that the presence of really good drugs encouraged. So in the interest of public health, I think the CDC had to make this recommendation. Some people don't agree with it, but for the most part, medical and public health community does agree with it. I certainly do.
Dr. Bloom wrote about this very scenario nearly 3 years ago. To read his entire op-ed and much more on this topic, you can head to our website, actia.org. That's acsh.org. And while you're there, don't forget to also sign up for your daily dose of news delivered right to your inbox. For Actia, I'm Anna Smovska.